heparin, which is one of the anticoagulants. Heparin is synthetically prepared, and it is having the GAGs and pentasaccharide. Means that heparin is produced when the GAGs and pentasaccharide are combined together. And we then have further two types of heparin: low molecular weight heparin and high molecular weight heparin. Now, what is the reason behind these two different types? The very reason is the pentasaccharide chain. When a short chain of pentasaccharide combines with the GAG, means glycoaminoglycan, then due to the short chain of pentasaccharide, the heparin that is produced will be called as low molecular weight heparin. And the case is obvious. High molecular weight heparin is the one that is having the GAG plus the long chain of the pentasaccharide. So then both of them have got different jobs. The very first one is low molecular weight. It will inhibit the factor 10. Which factor? Activated 10. And high molecular weight heparin is going to block the factor 10A and 2A. By A we mean activated factor 10 and activated factor 2. So coming to the mechanism of action, due to this long and short chain, the mechanisms are a bit different. Well, the heparin actually targets the antithrombin 3, which is present in the liver. And this antithrombin 3 has got a very interesting function, that is, it inhibits the factor 10A and it also inhibits the factor 2A. Here we were talking about the heparins that they are inhibiting. Now here the antithrombin is inhibiting. Don't make yourself confused. Why? Because the heparin is just accelerating the job of antithrombin 3. Means that when the heparin binds to the antithrombin 3, it will just accelerate the activity of antithrombin 3. Before, suppose antithrombin was supposed to bind to these two factors and it was inhibiting these two factors within 15 minutes. Now due to heparin, when heparin binds to antithrombin 3, now these factors will be inhibited within 3 minutes or 2 minutes. And like this, the heparin is just actually accelerating the action of the antithrombin 3. So its mechanism of action is to activate or to accelerate the activity of antithrombin 3. So now when activated factor 10A is blocked, what is going to happen? And when activated factor 2A is blocked, what is going to happen then? And we have been through the coagulation cascade, intrinsic and extrinsic pathway. So here the common factor 10, both the pathways actually join this common factor. And then this common factor, which is the common for both the pathways, extrinsic and intrinsic, then it is activated to produce the prothrombin A, then prothrombin, then thrombin, then fibrinogen, then fibrin, then clot is produced, coagulation and clot. So when we block this 10A and these 2A factors, what is going to happen? These factors are responsible to do the coagulation, and when we are blocking these factors, we are actually blocking or inhibiting the coagulation cascade. So what is going to happen? No coagulation, no clot formation. This is how the heparin is used as an anticoagulant medication. So in short, the heparin just binds to the antithrombin 3 and it is just accelerating the activity of antithrombin 3 to inhibit the factor 10A and 2A a little bit quicker. And like this, when these factors are inhibited, so then there is no coagulation. This is how the heparin is doing its job as an anticoagulant medication. So if still you have any kind of question regarding the topic, you can drop that in the comment box. We'll come for the answers very soon. Thank you for watching.